This is Jefferson Close-Up, and I'm Carol Celine. My guest today is Dr. George Francos. Welcome. Nice to have you here. Now, you were telling me, as we talked a bit earlier, that your childhood was in Lancaster County, and it was rather idyllic. You hunted, fished, did all sorts of outdoor things, and you also had lots of unusual jobs. Tell us a little about some of them.
The jobs started when I was 13 years old. I got a job working at the local hospital in the summer, and I cleaned nurses' dorms, going down one row and down the other row of rooms for 6 weeks.
Now, you talked about cleaning nurses' dorms, but you were actually exposed to medicine through your father.
Right. When I was very young, I used to go with him on house calls, and I had to wait in the car, but that was still fun. We used to ride around all over the county, usually after hours, which was no problem in those days. And then when I got older, I would stop by the hospital and visit him in the ER for a little while, watch him doing procedures in the emergency room. And it ultimately resulted in my pursuing a career in medicine.
Now let's talk a little bit about your work. You were are the medical director of the Kidney and Pancreas Transplant Program, the medical director. So what do you do?
We evaluate people, and our surgeons do this as well, but we evaluate people that have renal failure and who are going to require either continued dialysis or preferably a kidney transplant.
You follow kidney patients for many, many years, you indicated. Why do you need to stay with them for so long?
We follow patients for years with kidney disease before their own kidneys fail, and they go on to require either dialysis or preferably a transplant. So in my general nephrology practice, I follow patients for hopefully a long time before they come in to need an organ transplant. And once they get that organ, it hopefully lasts many years. For a deceased donor organ, on average, the kidney will last 8 years, and for a live donor organ, approximately twice that long.
Now, what is unique or special about your practice here at Jefferson?
There are two ways to view yourself or to look for success as a transplant program. In some programs, the name of the game is the number. How many transplants did I do last year? And I've never had that kind of pressure at Jefferson to crank out numbers. We've always been interested in quality, and our outcomes are very, very good as a result. We think because we have some little more experience in taking care of transplant patients that we do them good by following them forever. We see you an awful lot in the first 3 months, but at that point, follow-up becomes a little less frequent. And for example, the rest of the first year, a patient needs to be seen every month. So we ask patients to see their local nephrologist in April, see us in May, and so forth. That way, we stay in the mix. And if a problem comes up, call Jefferson, they know you, there's a problem.
Well, the they know you has to be what's important, because it's got to be very comforting for someone at a community hospital to know that they can always come back to Jefferson if necessary, since this kidney thing is going to go on and on the rest of their lives.
That's correct.
Yeah. Very informative. Nice to have you here.
Thank you very much.